Stomach and kidney. Remember that? So stomach, we have stomach 40, stomach 40.5, stomach 41. Those are my recommended points. And kidney will be kidney 2, kidney 3, kidney 4, kidney 7, anything along the line that you can choose and pick. And pericardium will be 木关, 骨关, 中关. Or pericardium 8, 7.2, 7, 6. And then this one for large intestine 3, 4, 5, 6, or you can use our 腰痛 5. That means 腰痛 5 needles. You can do that too. And then you always remember that if we have anything happen in our organs, you always go to the ear. Ear can show your internal organs right in front of your face. You can see everything inside your cavity. It's that beautiful, okay? So we're gonna go to use our uterus. Both sides means times 2 means both sides. Okay? Both sides. That's my my handwrite notes. Okay. So now let's see. Large intestine, balanced kidney, system 4. Pericardium, balanced stomach, system 2 and 4. Pericardium, balanced kidney, system 5. Stomach, balanced large intestine, system 1. So now we have a perfect structure to treat the narrow front, anything related with the uterus, any like real organ things, real organs, okay? Make sense? All right. Yes.
If we're using large intestine, instead of large intestine, Yao Tong Wu Yang, are you saying that in this case, it's classified as a large intestine channel treatment, or can it be used for other channels instead or as well? And same with Mu, Gu, Zhong, and Guan for pericardium.
So the reason why I was increasing those needles in the group of 5, because you know large intestine 4 or 3, they're not strong enough to treat the whole lower back soreness. You know those ladies, they are just can't even stand up whenever they have their period. That's really bad. And then one needle usually is not enough. So I am covering the whole back from the UB to GB, which is right here, UB to GB. Right, UB to GB. And Yao Tong is extra points to support the back. That's why you choose those points to take care of those ladies, right? And then Mu Guan, Gu Guan, Zhong Guan, the same thing. You only need to use Zhong Guan, which is pericardium 7.2 is on pericardium line, okay? But the others I already mentioned. If you want to treat the ovary, you can add them. All the points that I gave you to equip you, any deviation from what I was introduced you, just the uterus. Because they're not just coming with the one problem, uterus. They might come in with like my ovary here hurts, my lower back very sore, and my uterus is messed up. That's what your patient said, I'm messed up, right? It's so many things, and my uterus, my ovary, my back. 1 or 2 points might not be enough. That's why we need more to help us to get the job done. You need to clean the problem.
So it's not either or, it's large intestine plus. Is that correct? For the Yao Tong Wu.
Okay. Yao Tong 5, you can do large intestine 4 if this person doesn't have back pain. Okay? If there's no back pain, Yao Tong, you don't need to do Yao Tong 5. Make sense? But again, when we do Yao Tong 5, they can also tonify your kidney energy. If you know this lady is going to deplete it on her kidney energy, why not doing it? So my recommendation for you is, if it's not necessary for you to use it, don't use it. But if you see that patient working hard and then always tired And then when she has a period, she has no pain, but you know her face are pale, you know that something is missing. Even though she is not saying anything, but that will cover her whole back, so she will feel like I'm standing a little taller today after the treatment. Not because she's taller, she just feels the qi comes back. You know, the zhong qi. So they feels better like this. That's how you see how you want to treat your patient. It's not required for you to use Yao Tong 5, but Yao Tong, the large intestine 4 is good enough. But if you want added bonus for your patient, why not? Go for it. Okay? I give you options because I want to make sure when you go home, nobody coming with a clean case for you. So you know what you're going to do. I don't want you to flip the patient over and put the needle in the back. Then it's another 20 minutes. Then flip it back another 20 minutes. With this treatment, another 20 minutes. You don't have that much time. You want to be able to go in there, scan all the problems. You know how to do it. You have a pattern. You put the needles in. You cover the front, the back, the side, everything you'll cover. So when I remove the needles, patient feels good. Efficiency. Instant results. That's what Dr. Tan always says, instant results. You want to see it. Not just 6 seconds, you know what's going on. After the treatment, patient feels great. They feel good. They feel like they really slept for the past 20 hours of good and sleep. And now this 1 hour or 45 minutes, they really rejuvenate. That's your job. By doing so, you can also add the Anmian 5, the Sleep Well 5 needles. It's Yin Tang, ear Senmen, and Anmian in the back of the ear. And I can show you the pictures in here. I'm going to take a picture of this so you will not be missing. Okay? This is Anmian 5. Sorry for the writings on top because I don't want to lose it. So I'm going to show you right here. This is Yin Tang. This is Senmen. You already know. The only thing you don't know is here is Anmian. Behind the ear, there is a dip on this bone. What is the bone? Mastoid bone. There is a holes here. And that is where you put the Anmian 5. The Anmian is extra points. You can find it on your book for the extra point area. Anmian means quiet sleep. So anybody who doesn't sleep well, you can use this. No matter you are difficult fall asleep, difficult staying asleep, or wake up easy, you can use this. All right? Also for the people who's always very anxious, or people who's very explosion in their temper, and everything have to do their way, and they are very uptight, easy to get irritable, you do this. And they'll love you. They will come back to see you every time they can. So this is another Dr. Tan's magical combos called Anmian 5. Yin Tang, ear Senmen, Anmian at the back of the ear. Okay? So please try that. And especially people in San Diego right now, they are very anxious. I don't know what's going on. Usually San Diegans are very relaxed with the sandals. Not anymore. I don't know what happened to them. I feel like they're changing to become a New Yorker. I'm not saying New York is bad, okay? It's just the energy is very fast paced. People want to get to where they want to go. They don't want to deviate from their goals. So, but in San Diego, it's supposed to be like this. What's going on? Having some margarita? Not anymore, okay? So yes, it's a little changing in San Diego. So I use this a lot. Almost every patient that walks in, I put this on first. So they don't talk forever. They fall asleep like, don't you have that patience? They want to just talk to you. And I only see patients about 5 to 7 minutes per person that I would spend time with them. I will lay them down, They will be on the table or recliner already before I walk in. If they are not ready, they're still hanging on their phone. And then I stick my head in there. They're not ready. I say, you're not ready? Okay, I'm going to come back and see you in a minute. That means 8 minutes. They know. They know. They say, oh, no, I'm ready. I have no phone. So I say, no, you're not. And then your pants is not rolled to your knee. I can't see you. Otherwise, I have to bring a scissor in. I can cut it this way or this way. Which way you want? Oh, it's up. So when they learn, so you will have a patient be there, ready for you to treat. So you don't waste your time, right? You train them. So a lot of people come into a lot of my associates, I invite them to come into my office. Sometimes I have to leave town, so I have them to treat my patient. All they said to me is, how did you train your patients? I say, what do you mean, how do I train my patients? They all lay there, they're all ready, they're just lay there, and some of them already fall asleep if I even walk in. I say, here you go. Because they don't catch the time that I'm going to in your room, you're going to wait another 10 minutes, another 8 minutes. So they're always ready when I'm in there. So once they're ready, they tell me what they want. I have digestion problem, my stomach doesn't feel good. I think I may be pregnant, I may be not because of my period delay for 2 weeks. So I check the pulse right away, see if they're pregnant or not, right? This is very important. You don't just do something that going to jeopardize what we're doing there. And then, I cannot sleep because I read too much about how to get pregnant, how to see the babies, and all that. And now, I don't know what to eat. I constipated. I'm working so hard. I don't know what to do. And then I already checked the pulse, look at their tongue, look at their face, look at their color. So I start putting the needles in. They say, my husband's really happy that I'm seeing you because every time if I'm not happy, he always says, how's Eileen doing? So I know I have to go see you because that's how my husband hint me. So after she's talking about two minutes, needles done. So that is about 5 minutes already in the room. I say, I did this for you. Anything that I'm missing that I didn't do. They're like, I knew it. You're going to take care of me. Cover, no cover. Cover, please. Put on the cover. I'm out 7 to 8 minutes. So I'm working when they're talking. I don't sit there talking to them. Then you get anxious. 5 patients waiting back there. What are you going to do? Right? You cannot stop them. Then they will say, you never pay attention to me. I will never come back again. Right? You know those patients. Very dramatic. So you understand how they work, how they want, and that's what you do. Okay? Make sense? All right. So Anmian 5 will be the number 1 that I would do. So they already relax. When they relax, you put in your what? 中观, 目观, 骨观, if that is necessary. Or that you will put it in any needle that I think is appropriate for this treatment. Anything here along the line, including the uterus. Okay? That's the first pattern that you can do. This is more of organ, like uterus, like bladder. And the next pattern, and we're going to introduce you, is the one that is going to be more hormonal and also the retention of the waters and all that. Yes, what's your question?
For men, can you use this for prostate? And if so, would you just use Zongguan or would you use all 3?
All right, he has a great question. He asked, can I use this on men? Yes. But we're not talking about men today. But I will give it to you because you're the man asking the question. So I think we can handle that. So for men, we have a different, no, we don't have a different, but it just, okay, do I want to tell that story? I think so, huh? All right. Are you guys ready for the story? Okay, there's another way of imaging of the genital area. Dr. Tan was talking about it. I was still selling needles. So what happened is there's another way you can imaging it is the eyes is testicles, the nose is penis, and then the mouth is anus for men. So for women, the eyes is ovary, the nose is the vagina, and then the mouth is anus. So my friend sit next to me selling the herbs. So she says, Eileen. I say, what's up? Shh. She says, I have a question. I say, I don't. She's still talking. She's a cute Chinese girl, very quiet. You never think she will ask a question like that. You only think the pervert like me will ask a question like that because people knows I talk a lot and I talk for everything. So she said, Eileen. I say, I don't want to hear it. It's nothing good. I'm going to ask you. I say, I'm not a doctor. But I'm still going to ask you. Fine, ask me. What if the nose is crooked? Is that going to be crooked? I say, how would I know? I sell needles. You have license. You should know better. But after that, I was like, maybe. You know, girls, right? And then we would giggle in the back, and Dr. Tan walk over and says, what's up, girls? I said, I'm good. Tina said, my friend Tina, Dr. Tan, Eileen has a question. No, I don't have a question. She asked me. I didn't ask anybody. And then, you know, she says, if this is crooked, what do you think? I was like, and Dr. Tan says, I knew you're going to have a question like this. It wasn't me, right? So after the seminar, I was like, Tina, you're so mean. After the seminar, everybody come to my desk, wants to buy needles, like a Lhasa out there, right? He says, Eileen, how much is your needles? It wasn't me. I hope everybody here knows, and I want everybody at home knows, it wasn't me. I didn't ask that question. If you're there at that seminar, it wasn't me. But anyway, so this is one of the ways that you can imaging. So I was all excited. So I was following Dr. Tan for a while. And then we were in Oregon College of Oriental Medicine. He was teaching man's problem. I was young and beautiful at that time. And I didn't have a boyfriend. So any guys are looking cute, that is just cute to me, right? That time, okay, I was young and beautiful before menopause, okay? So then I saw this young man behind, right there, very far. He keep on waving. I was assistant, so I went over there and said, what's up? Oh, my ball hurts. I was like, oh, okay. And so he said, Dr. Tan. Dr. Tan heard him finally and said, what's up? He says, I want to be the demo. My ball hurts. I was like, I like it, right? I was young and beautiful, and I was single. I can see anything I want to see, right? I thought I entitled to it, right? So I was so excited to come back and say, Sifu, let's do a demo. He said, what do you want to demo? I'm that young man. Come on. So he came down. So I said, Dr. Tan, Sifu, can we do logo? He said, no, we're doing balanced method. We use our limbs to treat the body. I was like, oh, okay. Sifu, how about eyeballs? His balls is right here. Eyeballs, needle his balls. Yeah. Dr. San said, no, you're a barbarian. I said, no. There are points you can treat, like choho, all that stuff, right? You can treat. He said, no. I was like, what else can you do? I was like, this is no fun. I thought I can see something, but I didn't see anything in action. He says there's another way to imaging and mirroring, so listen up. All right, so if this is a woman's uterus in the hand, right? What is a man's genital? So they are outside dangle, right? So what is outside dangle? What is the outside dangle? Come on, say something. Your fingers. I was like, so we're going to do fingers? Is that what we're going to do? He said, yes, that's why. The beautiful, read between the line, okay? So that's why when they do this, they're meaning for it, because that is really that. When you do this, that is really representing the peanuts. Also this one, okay? All right, so how do you put the needles in? If you guys have prostate problem, erectile, I'm sorry, erectile dysfunction? Erectile, sorry. ED. ED. So how did you do it? You needle, pericardium 9, pericardium 8, pericardium 7 is prostate. 9, 8, 7 is prostate. Okay? For girl, it's perineum. So for the large intestine, it will be large intestine 1, 2, 3, 4, 5 is prostate. Same thing, stomach 45, 44, 43, 42, 41 is prostate. And for the kidney 1, 2, 3, 4. 1, 2, 3, 4. 3 is, oh, you want to write it down? That's, I'm just kidding. Right here, visual. Read between the line, okay? This is prostate. This is the head. If you tender here, you needle here. Tender there on the tip, you needle here, or you can needle here. Some people have pain here. Here. You know what I'm saying. Okay? And here. So you just look, imaging. You brought me to this place that I have to answer. Haha. Okay, so here. I wasn't planning to teach anything about man's problem here, okay, today, but I did it anyway. So just remember, follow the meridian from the tip of the finger to the wrist, tip of the finger to the wrist, tip of the toe to the ankle, tip of the toe to the ankle. Yin yang, yin yang. Any questions? Can we do liver for the men? It's very important. Why? We do kidney 1, 2, 3, 4, 5, maybe 6, 7. Just pick the ankle right here. Okay, this is kidney 3, this is kidney 7, kidney 4 right here, kidney 2 is right here, right? So when we do men's problem, we have to move the kidney 1 from the bottom of the feet to the little toe, little toe. UB67 is here. You're gonna do the inside, like the heart 9, but it will be in the little toe. That will be kidney 1. For men's problem, okay? So men's problem for ED, there's 2 reasons. There are 2 kind of ED. One is doesn't come up. One is doesn't hold up, right? One is doesn't come up. It doesn't come up. Who's the problem? What kind of material is not working? It is the muscle. Is the skin? Is what? Is the tendon. Who said that? Good job. All right. Tendon is the problem. Who in charge of tendon? Here you go, liver. So we do liver 1, 2, 3, 4. If they don't raise, if they don't sustain, they can come up, but they don't sustain. Ooh, like that. Ooh, like that. You treat kidney. So kidney 1, 2, 3, 4, 7. Make sense? We add a liver with this pattern.